Hi, good afternoon. This has really been an interesting day. So we're going to go back to the United States and focus on some applied policy research, another facet of environmental health. So I'm Jill Litt. I'm in the Department of Environmental Health. And today I'm going to talk about a study that's been going on for the past couple of years. It's called the Coalitions and Networks for Active Living. And the title of my talk is Active Living on the Front Line of Communities. So this is really kind of the translational piece of our research and just trying to communicate some of the highlights of this study. I want to point out that this is a very big team of investigators from several universities, Hannah and myself from the Colorado School of Public Health. We have collaborators at San Francisco State University, Washington University in St. Louis, Georgia State University, Tulane University, West Virginia, and the University of Massachusetts, as well as two collaborators from the University of Colorado, Denver. And so this was a linkage between public health and the School of Public Affairs. Wow, I'm stumped. Where's the... the drawer was shut. Okay. Got it. So this is part of a study that is funded by the Centers for Disease Control and Prevention, and it's a special interest project that is through the Prevention Research Center. So we are part of the Rocky Mountain Prevention Research Center, and this was a special interest project, a thematic network funded to look at physical activity policy research. This is why the team is so large, and it's the first time I've been a part of a research network like this. So our members are across the country. Currently, there are 5 funded members, but there are 18 total participants. So the other folks are affiliates. And all of us have sort of floated in and out of funding depending on the cycle. So we've been at the University of Colorado, been funded for 5 years as part of this network. Oops. Sorry, I'll get this. And this particular study emerged, so as part of this network, we all put in our individual proposals, and then originally I had conceived of this study as something that would be local to Colorado. And the idea was that I had been an evaluator for Live Well Colorado, and I do want to acknowledge Molly Hansen, who has been one of the coordinators for one of the Live Well communities in Wheat Ridge. But I have been evaluating a different community funded by Live Well, and Live Well is a state organization that is advancing change at the community level to focus on active and healthy living. And one of the things that I noticed as an evaluator was that there was a lot of emphasis on every group that was funded by Live Well, and this is also true for other groups that receive funding from organizations like Kaiser or perhaps Aetna, some of these big kind of healthcare organizations paying communities to develop environment and policy change to address physical activity, diet as a way to get to obesity and other chronic diseases. But one of the things was that every community that receives funding is often required to form a group, and this group is sort of the engine for getting to change. And there's increasing emphasis on tackling system-level change, so the policy environment or environmental features, so the infrastructure, thinking about roads and parks and other kinds of amenities. But there was a formulaic approach to tackling this. So if a group was required to be formed, it was often that it had to be big, there were a lot of members, there had to be a very formal structure, these groups had to meet frequently. There was also sort of a formula of who had to be involved in these types of groups. They had to be multi-sectoral, and that they had to have a range of skills that would come together to help advance these kinds of agendas that would address physical inactivity and healthy eating. What I noticed with the group that I was working with was that they couldn't do that. They didn't want to do that. It didn't fit with the mission of the organization. So they were very informal about how they brought their group together. And I noticed that they were very successful in the various strategies that they were trying to promote. And so there was this constant tension over the years that this group was funded to produce reports and show evidence that this group was meeting frequently, that they had all the members together, that all the members knew each other. And yet this didn't quite work for this organization. So I really wanted to get at some of the informal processes that were at work. And this is sort of the birth of the CANAL study. When I had proposed a study, there was a lot of interest from the PAPRN, the Physical Activity Policy Research Network. So it suddenly sort of morphed into this national effort to look at what groups are doing across the country to advance environment and policy change. And that is the study that I will talk about today. Bear with me. So as this project emerged, we identified through a variety of channels 59 active living collaborative groups. And when I talk about collaboratives, I'm referring to informal and formal groups that have a goal to advance environment and policy change to address physical activity. The other requirement was that these groups had to have been together for at least 1 year. And the point here is that we wanted to get groups that were a little bit deeper into the process. In the Live Well example, groups were funded to do a planning year, and then they were funded for implementation. So we really wanted to get groups that had started to move forward in implementation. So we identified 96 groups that kind of met our criteria, and 59 agreed to participate. And through this research, we were able to conduct an in-depth phone interview with the coordinators of these groups, if there was a designated lead. And then sometimes it was like a small council of folks who participated in the interview, if that was kind of the structure for that group. And then the other piece of this, and this is the connection to the School of Public Affairs, is that we were able to do a network analysis. So we asked coordinators to enumerate the members, like the most influential members in their group, and invited them to participate to begin to get member perspective. So a lot of research focuses on the coordinator, but we really wanted to get the perspectives of other folks participating in this group so we could look at sort of goal alignment and how these groups are functioning. This would also give us sort of insights, and I'll talk about the conceptual framework, but about the functioning, the social cohesion within the group, and how they leverage their resources to affect change. So from the 96, 59 agreed to participate, and then of the 559 partners identified across these groups, 390 participated. So it was around 70% of partners associated with these 59 groups agreed to complete the survey. And the survey is based on a tool developed by Danielle Varda at the School of Public Affairs called Partner. And that's available online. It's a free tool that groups can use, and hundreds of groups have opted to try this out on their own. Oh my goodness, sorry. So this is the sample of the folks that participated, and largely this leans on the members of PAPRN. So these are based, sort of affiliated where groups had contacts, where they reached out to groups, they knew of groups, so the nominations tended to kind of concentrate in these areas. So obviously this isn't generalizable, but it's really the first inquiry into how groups are doing. And the other contextual piece that I'll mention is that this research is coming after 10 years, essentially, of Robert Wood Johnson investments and other major organizations, the National Institutes of Health, the Centers for Disease Control and Prevention, all coming out with the research, the evidence that suggested a whole range of strategies targeting the built environment and policy that could have an impact at the population level. What we wanted to know, in addition, was how are groups translating the message? And so that was why, again, we wanted to look at collaboratives, because these were the engines and communities across the country that were tasked with making this change happen. This is kind of just a very simplified framework for explaining some of the things that we wanted to look at. So a lot of research has focused on the composition of groups, and that's why there's a lot of recommendations out there that suggest how the groups should look and the structure and the formality of the group. We wanted to kind of expand that. Oh, and the other piece is that a lot of the research that looks at collaboratives focuses on functioning as an outcome, and we wanted to kind of extend this to look at intermediate outcomes. And so we were interested in policy and environmental change. Another tension in these groups is that many of these groups reside in public health departments or more formal public health organizations, and the funding that supports these groups is often restricted in the sense of what a group can do to advance change. So can they lobby? Or what kinds of engagement or advocacy can they do as a group to get to policy change? So we wanted to see how groups were sort of navigating this terrain, and that's this tactics and activity piece, because we think that this is very crucial for distinguishing why some groups are more successful than others. We wanted to get at the cohesion of groups, how groups are functioning, how they trust each other, the values and the social organization of groups, and then looking at how these various constructs relate to the outcomes of interest. For environment and policy change, I gave some examples, but we had done a number of interviews with practitioners trying to figure out, and we worked with LiveWell, we worked with Kaiser Permanente, trying to figure out what are the things that groups are working on. And so we decided to hone our outcome when we were looking at these different strategy areas to 8 categories. And the things that we wanted to know about were parks and recreation, transit and parking, plazas, so things like community gardens, children's play areas, streetscaping, so kind of the beautification of streets and plants and other aspects, street improvements, so crosswalks, making it more amenable for people to utilize environments for walking and other kinds of activity, infill and redevelopment, and then safe routes to school. And we asked the collaborative leads or the coordinators, we wanted to know how far they got in each of these strategy areas. So we had 5 categories, and this isn't perfect, but it was a way to get at progress and how far along these groups had gotten. So for each strategy area, they classified this, whether they worked on the strategy area, and then whether it was discussed, whether it was planned, funded, in progress, or completed. We also wanted to know whether these environmental changes required some kind of policy. So we asked folks about that, and respondents were able to choose whether no new policy was developed, there was a policy gap identified, it was identified and discussed, and policy was drafted or adopted. So again, this was just trying to quantify across these groups how they're doing in making changes to the environment. So these are just some preliminary results, or a snapshot of the results, I should say. So of the 59 groups, about almost half were somewhere in the 4 to 6 years of implementation. They had a range of partners, and on average, or just slightly less than average, about 11 to 30 partners. The groups were generally well-funded, and over 60% had slightly less than $200,000 in funding, sort of on an annual basis. So they had a fair amount of resources to work with. Most had a designated lead that was paid, so 85% had staff dedicated to working on these projects or these collaboratives. 76% had a designated lead, and most of the coordinators had at least 1 year of experience. The groups ranged from urban to suburban, 17% were in rural communities, and then almost 50% were sort of a mixed-use environment, or a mixed land environment, so rural, suburban, urban, or some kind of mix of that. And then we also just have a breakdown by counties and cities where more than half were in sort of a neighborhood environment. This is one display of how groups are doing, and I think you can see the full range. So what we learned in this research is that a lot of collaboratives are making progress, and the majority of groups tend to be working mostly on streetscaping, parks and recreation, and so the tan line that you see, that bar, is for groups that reported completing some kind of environmental change. So the majority of the work is kind of hovering in the areas of public plaza, streetscaping, and parks and recreation. One of the significant findings here is that as much effort as going into transportation planning and changing the street environment, making the streets more hospitable to active lifestyles, groups reported the least amount of progress in this area. And I remember presenting this at an international conference and hearing this huge guffaw in the back of the room, and it was a transportation planner who was deeply passionate about public health and working on these kinds of changes, and he felt that after a decade of effort and recommendations and funding, why is it that groups are still not able to accomplish this kind of change? And that's kind of opening up opportunities for us to kind of dig a little bit deeper about what is it about the hierarchical structure or the vertical structure of transportation planning and how public health collaboratives can be more effective in partnering with the transportation sector. So, and then likewise in infill and redevelopment. So these are more costly projects. These projects take a long time, so that could be another explanation for why these changes are more difficult to achieve. But that's something that we want to sort of further investigate. We also learned that Policy is harder for groups to get to. So unless you make a commitment, I know Molly has stories about the decision that her collaborative made, and this is just from many conversations we've had on the side about collaborative functioning and what groups are able to accomplish, is that there might have been, it's not really a low-hanging fruit. So you have to make a commitment to dedicate a tremendous amount of resources to get to change, like a master plan. And so it's not as sexy, and it takes a very long time negotiating, building partnerships, having the right people at the table to make that kind of change. And the results, the master plan becomes in place, for example, or a bike and pedestrian plan. But then you need the infrastructure dollars to actually implement the change. So the feedback doesn't happen for a much longer time frame. So not every community is set up to do that kind of change. But where we did see policy activities happening, again, was in the Parks and Rec area and streetscaping and street improvement. So these were things that groups could achieve more readily in a shorter time frame and probably less resources. Some very brief results. This is one of the models that we looked at to look at the factors that might explain why some groups are more effective in achieving change, both in the environmental change and also policy. The things that we learned was that we had age there for a reason. We thought that perhaps this is a confounder because older groups might be more positioned to have been together a longer time. But the things that stood out was that there were, first of all, different factors that influence why some groups are more successful in environmental change versus policy change. Groups that invested in community events, like street closure events, so Ciclovia is one example in Denver and other cities. Any kind of walkability assessments, any strategies that engage folks in these sort of one-day events over time seems to be an important piece of raising awareness and creating engagement. The other piece is engaging in media, so using media to raise awareness. So these were things that seemed to be important for groups that were able to get further along in the environmental change. For policy, it seemed that groups that were able to partner with policymakers, offer testimony, get involved in the policymaking process, and engage community leaders were more likely to be able to adopt policy. And this intuitively makes sense, but it's very challenging to do. And it also flies in the face, again, of restrictions in terms of what groups are able to actively invest in terms of advocacy strategies. So these are some of our brief findings or some initial findings about the factors that seem to matter in distinguishing groups. Okay, so what we learned was that collaborative groups are translating the message, but that there's variation in how they're doing it, and that some groups are able to accomplish more change than others. We found that community and policy engagement is crucial, and that most groups are using it, but the intensity of use is varying. We found that all groups are attempting to make changes. They're hearing the message from the national organizations like Robert Wood Johnson. They're reading the evidence. They're choosing strategies that have a strong base of evidence. But the ability to follow through on these projects varies across groups. And that we found that most groups are effective as they engage their membership, the community, and decision makers in their processes. So I do want to acknowledge the Centers for Disease Control, the Physical Activity Policy Research Network, the many communities that shared their time and stories, Kaiser, Live Well Colorado, Wisconsin Department of Health Services, which was a really important partner when we were developing our tools, and Denver Environmental Health. Thank you. I don't know. I mean, Molly, do you have any Things that stand out where you guys have been most successful? Yeah, and I would say that I think the conversation has shifted. I don't have other concrete examples, except for example, like a bike network that might be implemented within a city. So going from a master plan or a bike ped plan, the next step would be actually implementing it and having the resources to change the roads to create space for bicycles. So Denver has been fairly successful in its ability to get the ridership up a bit, although it's still dismally low. I mean, and cities across the country have very low bike ridership. But that would be another example, is moving from a plan that makes a commitment to having the bike lanes and then creating the infrastructure to support that.